You know that feeling when your joints are a little stiff in the morning? Or maybe someone you know is always mentioning their aching back.
Yeah, it's pretty common stuff.
Well, today we're diving deep into the fascinating world of degenerative musculoskeletal disorders.
That's right. We're talking about how our bones, joints, and muscles can change, over time.
Exactly. We're going to explore how these changes can lead to really common issues like osteoarthritis, osteoporosis, and degenerative disc disease.
And our goal here is really just to give you a clear understanding of what's happening inside your body when these conditions develop.
Right. We want to unpack the essentials, like the key players in your body, what can go wrong, how it gets spotted, and what the options are.
But without drowning you in, super technical medical jargon.
Yeah. Hopefully, we can unlock some aha moments about how your amazing body works. So, where should we begin?
Well, I think starting with the basics makes sense, how things should work.
Okay. The foundation, normal anatomy and physiology.
Yeah. Exactly. Understanding the healthy setup is really key to getting what happens when things change. So let's start with bones.
All right. Bones.
They're fundamental, right?
Right.
They give us structure, protect our organs, store minerals. They even produce blood cells.
Wow. Okay. More than just scaffolding.
Definitely. Then we have joints.
Yeah.
That's where bones meet, allowing movement. And synovial joints, think knees, hips. They're especially interesting because they allow such a wide range of motion.
Right.
And finally, muscles. They attach to bones via tendons, and they're basically the engines for our movement. They contract, pull on the bones.
And we move. Okay. So, bones for structure, joints for bending, muscles for power. What about the smaller details, the bits we don't see?
Yeah, the microscopic stuff is crucial. Inside bones, you've got this constant remodeling going on. They're osteoblasts.
Builders?
Yep, the construction crew building new bone.
Hmm?
Then osteoclasts, they're the demolition team breaking down old bone.
Okay.
And osteocytes are kind of like the maintenance crew, keeping everything running smoothly.
Got it. Builder, demolisher, maintainer. And in the joints.
Cartilage is vital there. It's that smooth, slippery lining on the ends of bones, lets them glide past each other easily.
Like Teflon on a pan, maybe.
That's a great analogy, yeah. And synovial fluid is the lubricant, like oil, making sure it all moves smoothly.
Okay.
And don't forget ligaments, strong bands connecting bone to bone for stability. And tendons, which connect muscle to bone, transferring the force.
So it's this incredible balance, isn't it? Building up, breaking down, smooth surfaces, lubrication,
Yeah.
all working together.
Precisely. When it's all working right, it's amazing.
So what happens to this whole system as well as time goes by? What are the main drivers of change?
Well, aging is definitely a primary factor. It's natural. Over time, we tend to see a bit of a dip in bone density. Cartilage can gradually wear down, and maybe some muscle loss, too.
Okay, so wear and tear is part of it. Let's zoom in on specifics like osteoarthritis or OA.
Right, OA is super common. Remember that smooth cartilage lining?
Yeah, the Teflon.
In OA, that starts to wear away. It thins out, disappears in spots. Then the bones beneath can start rubbing directly against each other.
Oof. Bone on bone sounds bad.
It is. That friction causes pain, stiffness, and the body might try to compensate by forming little bony growths called spurs. The space within the joint also narrows.
Okay, that makes sense. And then there's osteoporosis. We hear about that a lot, especially with brittle bones in older adults.
Exactly. Think of healthy bone like a dense honeycomb structure, strong.
Okay.
In osteoporosis, the holes in that honeycomb get bigger. The bone becomes less dense, weaker, and much more prone to fracturing.
Why does that happen?
It's usually an imbalance. The demolition crew, the osteoclasts, are working faster than the building crew, the osteoplasts. So more bone is broken down than is rebuilt.
Ah, okay.
And the tricky thing about osteoporosis is that it's often, silent. You don't feel your bones getting weaker.
Oh, something breaks.
Exactly. Often the first sign is a fracture, maybe from a minor fall or sometimes seemingly out of nowhere.
That quiet progression is a bit scary. What about degenerative disc disease? That sounds like a big cause of back trouble.
It certainly can be. Picture the discs between your vertebrae, the bones in your spine. They're like little cushions or shock absorbers.
Right.
In degenerative disc disease, these discs can lose water content over time. They dehydrate, become thinner, less springy, kind of like old sponges drying out.
And that causes problems.
It can. When they lose height or bulge outwards, they can press on nearby nerves.
Okay, so we've got OA, osteoporosis, DDD. Our source also mentioned a couple of others, ankylosing spondylitis and a vascular necrosis. Are they tied to aging too?
Well, they fall into the same broad category, but their main causes are a bit different. Ankylosing spondylitis is more of an inflammatory thing affecting the spine, sometimes causing bones to fuse.
Ah, okay.
And a vascular necrosis is actually bone tissue dying because it loses its blood supply. So, while they're related musculoskeletal issues, they aren't purely age-related degeneration in the same way as OA or DDD. We'll mostly stick to the big three today.
Got it. Good to clarify. So we know it's happening sort of structurally, pathologically, but how do these changes actually, feel? What are the signals our bodies send out?
Good question. With osteoarthritis, the classic signs are joint pain and stiffness, often worse after you've been still for a while, like getting up in the morning.
Makes sense.
You might also hear or feel a kind of clicking, grinding, or crackling sound when the joint moves. That's called crepitus.
Crepitus,
Yeah.
right, like rubbing sandpaper.
Sort of, yeah. Range of motion can decrease too, and sometimes you'll notice swelling around the joint. That can be from inflammation and also the thickening of the joint lining, the synovium.
Ah, so the swelling isn't just fluid, the lining itself changes.
Exactly. Now, for osteoporosis, remember, it's often silent.
Right, the scary part.
So the first clear sign is often, unfortunately, a fracture, breaking a bone from a minor bump or fall. Over time, though, some people might notice they're getting shorter or developing that forward curve in the upper back kyphosis.
Okay. And for degenerative disc disease, the back problems.
Yeah, back pain is the main player there. Sometimes it's localized, sometimes it radiates, like down the leg, that's sciatica.
Uh-huh.
Depending on which nerves are getting pinched or irritated, you might also get numbness, tingling, or even weakness in your legs or feet.
So it sounds like generally decreased mobility, maybe some swelling or joint changes, and muscle weakness could pop up across several of these conditions.
Absolutely. Those are definitely common threads, kind of red flags that something's up with the musculoskeletal system. The specific pattern and severity helps point towards the diagnosis, though.
Okay, so if someone's experiencing these kinds of signals, what happens next? How do doctors actually figure out which condition it is? Let's talk assessment and diagnosis.
Right. Usually starts with a good chat about your symptoms and medical history, followed by a physical exam.
What does that involve?
The doctor will look closely at the affected joints, checking for swelling, warmth, redness, any deformities. They'll gently press around the area to see where it's tender. And they'll test your range of motion, how far you can move the joint, and check your muscle strength around it. Maybe test reflexes too, especially if nerve issues are suspected.
Makes sense. What about lab tests? Does blood work help?
It can. Certain tests give clues. For instance, checking calcium and vitamin D levels is important for bone health overall.
Crucial, yeah.
We might look at bone turnover markers.
Yeah.
They give an idea of how fast bone is being built and broken down. And sometimes blood tests help rule out other conditions. Like if we suspect rheumatoid arthritis, which is autoimmune, specific tests can help differentiate it from osteoarthritis.
Okay, so physical exam, maybe some blood tests, then we get to the pictures, right?
Mhm.
Imaging, x-rays, MRIs.
Exactly. Different types of imaging show different things best. X-rays are really good for looking at bones.
What do they show for these conditions?
For OA, X-rays can show that narrowing of the joint space we talked about, plus any bone spurs. For osteoporosis, they might show general bone thinning, but they aren't the main tool for diagnosing it. They are good for spotting fractures, though.
Okay. And MRIs.
MRI gives much better detail on soft tissues, so cartilage damage, ligaments, tendons, and especially those intervertebral discs in the spine. It's key for diagnosing disc problems.
Gotcha. And there's one more scan, right? The DEXA.
Yes, the DEXA scan. That's the gold standard for measuring bone mineral density. It directly tells us how dense or strong your bones are
Yeah.
and is the primary way to diagnose osteoporosis and assess fracture risk.
Okay, so putting it all together, symptoms, exam, labs, imaging that builds the picture.
Pretty much, yeah. Leads to the diagnosis.
So once there's a diagnosis, what can be done? What are the strategies for managing these conditions? The treatment side of things.
There's actually a pretty wide range of options, and often combining approaches works best, starting with medications.
Like pain relief.
Yeah, things like NSAIDs, ibuprofen, naproxen help with both pain and inflammation. Acetaminophen or Tylenol mostly helps with pain.
Okay, common stuff. Anything more specific?
For osteoporosis, a major class of drugs are the bisphosphonates, like alendronate. They work by slowing down that bone breakdown process.
Right, tackling the underlying imbalance.
Exactly. And sometimes, for really inflamed joints, like in severe OA flare-ups, injecting corticosteroids directly into the joint can give powerful, targeted relief.
Okay, So those are some drug options. What about non-drug approaches, things people can do themselves?
Oh, these are hugely important. Often the first line of defense, really. Physical therapy is key.
How does that help?
PT helps maintain mobility, strengthens the muscles around the joints for better support, improves balance, which is crucial for preventing falls, especially with osteoporosis.
Right. Makes sense.
Weight management is also big. If you're carrying extra weight, losing even a bit can take a lot of stress off joints like your hips and knees.
Less load, less strain.
Exactly. And exercise. Low-impact exercise is generally great. Think walking, swimming, cycling. It keeps joints moving and muscles strong without jarring them too much.
So staying active, but maybe modifying how you're active.
Precisely. Sometimes using braces or supports for specific joints can provide stability and ease pain. And simple things like heat packs for stiffness or cold packs for inflammation can be really effective for managing symptoms day to day.
It sounds like there's a lot you can actively do, but I guess sometimes these aren't enough. When does surgery come into play?
Surgery is usually reserved for when other treatments haven't worked well enough, and the condition is really impacting someone's quality of life and ability to function.
Like what kinds of surgery?
For severe osteoarthritis, especially in the hip or knee, joint replacement surgery can be life-changing. It dramatically reduces pain and restores function for most people.
Wow, yeah.
For certain spinal issues from degenerative disc disease, like severe nerve compression or instability, spinal fusion surgery might be an option to stabilize the spine.
Okay.
And for those painful vertebral compression fractures you can get with osteoporosis, there are procedures like vertebroplasty or kyphoplasty, where cement is injected to stabilize the broken bone.
So quite a spectrum lifestyle. Meds, injections, and then surgery as a last resort sometimes. Good to know the options exist.
Definitely.
Now, thinking longer term, what happens if these conditions aren't managed well? What are the potential complications we should be aware of?
Yeah, the complications can be significant. With osteoarthritis, the big one is progressive loss of joint function. It can get to the point where it causes real disability, making everyday tasks hard.
Limiting independence?
Yes. For osteoporosis, the main danger is fractures. Hip fractures are particularly serious. They often require surgery and can lead to long-term mobility issues, loss of independence, and unfortunately, even increased mortality risk. Spine and wrist fractures are also common and debilitating.
That's quite serious. And degenerative disc disease.
That can lead to persistent chronic back pain that's hard to manage. If nerves are compressed long-term, it can cause ongoing pain, numbness, weakness, and really limit mobility.
Sounds like quality of life can really take a hit across the board. Our source also mentioned some sort of broader risks too.
Yeah, absolutely. Living with chronic pain, which is common with all these conditions, takes a toll mentally. It significantly increases the risk of depression and anxiety.
That makes total sense, the mind-body connection.
Definitely. And the reduced mobility, maybe balance problems.
Mm.
That raises the risk of falls, especially as people get older. Falls can then lead to fractures, creating a vicious cycle.
Right.
Plus, if you're moving less because of pain or stiffness, your muscles can weaken and waste away. That's muscle atrophy.
Yeah.
And weaker muscles provide less support for joints, potentially making things worse.
Wow, it really highlights how interconnected everything is. Physical health, mental health, mobility, independence.
Absolutely. It underscores why catching these things early and managing them proactively is so important. It can make a massive difference in slowing things down and minimizing the impact on someone's life.
Okay, this has been incredibly informative. Let's maybe try and wrap things up. We've really dug into degenerative musculoskeletal disorders today.
Yeah, we covered quite a bit. For the basic anatomy, bones, joints, muscles, to what goes wrong in conditions like OA, osteoporosis, and DDD.
Right, and how they show up, how doctors diagnose them using exams, labs, imaging.
And the whole range of treatments, from physical therapy and lifestyle changes to medications and even surgery when needed. Plus, the potential complications.
Hopefully for everyone listening, you have a clearer picture now of what these conditions involve, maybe why they happen, and what can be done. It's knowledge that's useful for understanding your own body, or perhaps what someone you know is going through.
Definitely.
So here's a final thought to chew on as you go about your day. Knowing how interconnected our bones, joints, and muscles truly are. What small, consistent habits, maybe it's the particular type of movement, or focusing on posture, or even something dietary. What small things might actually have the biggest long-term positive impact on keeping our musculoskeletal system healthy as we age?
That's a great question to ponder. Small steps, big impact, potentially.
Something to think about.